These were such great talks, and I so appreciate you giving me the chance to kind of wrap it all up. So, Norbert did such a great job of really talking about the kind of theoretical underpinnings of understanding behavior. That the idea that there's kind of many psychological views that are kind of needed to understand the unique characteristics of PWS. And I love what he said. It's a big, complex task that is needed and to understand and handle PWS behaviors, right? It's not easy. So people who try to like make it just like, so easy, like it's not. So he talked about the system, the theory perspective, which is like not just experts kind of weighing in, but parents and families and teachers and staff. And the idea of interactions between stakeholders can help us understand behavior outside of just the person with PWS, and that you can change behavior just by actually focusing on those other people involved and other environmental things involved instead of just the person with PWS. And the idea of cognitive development, where people with PWS are kind of at their level, right? It's kind of understanding that, knowing that, and really kind of understanding that they're in that pre-operational Piaget stage where they need help and support and understanding to kind of move to the next stage. So it's understanding we're not going to push them forward, but we can work on those things by knowing where they are and knowing where we want to move them. He talked about the social and emotional development in PWS and kind of understanding behavior. And the idea in understanding that context is so important. And this idea that if we look at the behavior in the situation, what happens before, what happens after, it can really tell us what's going on instead of focusing on the behavior right at that moment. That's just a snapshot, and it doesn't give us the whole thing. He talked a little bit about Seligman's positive psychology perspective, this idea that there are 5 elements of well-being and quality of life that are kind of experienced by the person with PWS. And this kind of helps us understand that when these things are not in whack, when they're not like kind of working optimally, it kind of helps us understand more of the challenging behavior. So I thought it was really good to kind of see that, we need all of these perspectives to kind of describe and understand PWS and to know that it's complex. But if we can understand kind of some of the underpinnings, it kind of help us figure out what's going on, how we intervene, how we can help. Casey, on the other hand, kind of had a nuts and bolts approach, right? The idea of like, ABA is the science of human behavior, how behavior is shaped and maintained by the environment and other factors. And then, it's been used a lot in autism and whatever else, but also really more increasingly being used in PWS. And, this idea of if we know why the behavior occurs, we can actually change it, right? So the idea of environment isn't the only driver of behavior. I love that she said this because I think for so many other ABA folks, they get it, but they don't get that genetics and biology and all these other things are really kind of hardwired. And it's like asking your, TV to make toast. It's like, it can't do that. So how are we going to find ways to kind of work around that? This idea of biological processes impact behavior. And so she talked a lot about behavior and environment, that there are 4 main functions of behavior: sensory, escape, attention, and tangibles. And that many people, again, have multiple reasons that they're doing these behaviors. So to just focus on attention or just to focus on tangibles is really kind of missing the boat because you're not actually hitting all of the motivating kind of factors for them. The idea of behavioral considerations of PWS, the fact that they have executive functioning deficits, which affect emotional regulation, auditory processing, problem solving. Those are all deficits in PWS. Lack of motivation, skill deficits, reduced pain sensation. The idea of interventions that are commonly used in ABA, like teaching skills, reinforcement, and then kind of changing environmental contingencies, are really important to kind of think about skin picking, right? What are we doing? What is the behavior doing? Can we kind of start out with one factor like reduced pain sensation? And that may help us figure out that there's also a pain and avoidance factor that kind of goes in there as well. And so it was a really nice way to kind of broaden, to me, the ABA perspective, which can sometimes be kind of narrow. And it's harder, like you said, to actually use in people with PWS unless you figure out all the things that are going on. Marguerite had a beautiful case, kind of presentation talking about her son and the idea of kind of like the implementing behavioral interventions in a family setting versus a residential setting. And Patrice made a great point of it's a little easier when you get to go home at the end of the day and you've got this huge support staff and you've got all this kind of like institutional knowledge about PWS and what works and what doesn't work. And then we ask parents to become experts and run their own stupid group home at home. It's like, it's maybe not a very fair thing to put on parents. So sometimes you have to kind of say, you did the best you could in the situation you were in. And you got to, like you said, if everybody lived to live another day, that is a success, but kind of realizing that there are just a lot of things going on in the situation. So we really have to kind of understand the theoretical and, kind of underpinnings of what is kind of where they are, understanding how to use the principles of ABA to kind of help move them where you want them to be, and kind of constantly reevaluating and getting input and buy-in from the person with PWS. We may be experts in behavior, we're not experts in them. And if we don't inform and get buy-in from them, we're not going to really be able to effectively intervene with some of these behaviors. So kind of knowing that everybody needs to pull up to the table, tell us what they need, what they want, what works for them, and try as best we can to get everybody of some of what they want so that we can actually be effective in maintaining, more positive behavior and less maladaptive behavior.